So welcome, Union Station employees. This is your 2016 Employee Benefits Open Enrollment webinar. My name is Guillermo Gonzalez from Arroyo Insurance Services, and we are your employee benefits brokers. So I'm going to walk you through the changes on the employee benefits program effective September 1st, 2016. So as I mentioned, the Arroyo team, we are your employee benefits brokers, and I'm here to review employer-sponsored medical plans. I'm going to present you any changes, and we're also assisting HR in managing your benefits. August is the open enrollment period for our employee benefits program. And in this meeting, you're going to have the opportunity to ask questions and discuss your specific needs. We're also available to consult with you on a one-on-one basis, so we can have a conference call set up later so that we can discuss any changes you need to make or any individual medical utilization needs. Okay, so the open enrollment window. Monday, August 1st through Friday, August 12th is your open enrollment period, and right now would be the time to make any changes such as adding or removing dependents. New this year is that everyone needs to enroll onto a new medical plan. Okay, so the old plans are going away. We do have new medical plans. If you're not on the plan and have satisfied your waiting period, this is your opportunity to enroll. So again, all employees will be required to select a new medical plan and enroll through the Maxwell Health Benefits Administration system. The annual open enrollment period is the only opportunity you have to make any plan changes during the year without a qualifying event. The qualifying event constitutes as loss of insurance coverage, as if you had spousal coverage through a spouse, if you had medical coverage through a spouse. If you have the birth of a child, you can add them at any time within a month of their birth. And then if you are married and or divorced, those are the three things that would trigger a qualifying event, which you can make a plan change. Again, this year's time window to enroll is August 1st to August 12th. Okay, so employees will have the opportunity to ask questions, discuss their specific needs, and have assistance with Maxwell Health after this meeting and on the following dates. Okay, so if you are available for the enrollment workshops, the one-on-one consultations, this is when we will be at the Orange Grove office, Union Station's headquarters. So Tuesday, August 2nd, 9 a.m. to 12 p.m. and 3 p.m. to 5 p.m. Wednesday, August 3rd, 9 a.m. to 12 p.m. Friday, August 5th, 9 a.m. to 12 p.m. and Monday, August 8th at 2 p.m. to 5 p.m. So again, these are the times when you can sign up for a one-on-one consultation to discuss your specific needs, but also if you're having troubles with the Maxwell Health online system, we will be available to walk you through. Okay, so I wanted to address what makes medical insurance so expensive. And if you haven't noticed, it's really expensive. Medical insurance is one of the most expensive insurances there is. And this is because the cost of delivering medical care increases 5 to 10% every year. This is due to new prescription drugs, new diagnostic technologies, increased life expectancies, cost of labor through hospitals and medical centers, and then the utilization. It's the way that we consume care. When you factor all that in and the Affordable Care Act taxes, fees, and federal compliance requirements, we're seeing an additional 6 to 8% added to the premium for each employee every year. And the employers are absorbing this cost. So managing the cost. Our role is to have a healthy utilization of it, a very responsible utilization of our medical insurance. This means getting your preventative care every year, your physical and your well-woman exam, as well as healthy diet and exercise. These tips will help you prevent those larger claims down the road. All right, so what is staying the same? We are able to continue a very high level of benefits. So all eligible employees may select medical, dental, and vision plans provided by Union Station with the following allowances. So these are the employer contributions. For full-time, employees contribute $40 a month or $20 per payroll for any HMO base plan elected. Union Station pays the remaining monthly cost for the employee-only premium. Employees cover 100% of the cost for all dependents. For part-time employees, employees contribute $40 a month or $20 per payroll for any HMO base plan elected plus 50% of the remaining premium. Union Station pays the other 50% of the remaining premium for the employee only. Employees then cover 100% of costs for all dependents. Dental and vision are both voluntary benefits, and employees cover those at 100% of the cost. So here are our medical plan providers. California Choice will continue to be our private exchange, where we have access to the Kaiser plans alongside Aetna, alongside another Aetna plan, and then an Anthem plan. The Kaiser plan that we chose as the base plan is the Kaiser Platinum HMO-A. The private practice HMO plan that we've chosen as the base plan is the Aetna Platinum HMO-A. There are buy-down plans available, and the buy-down plans would be if you wanted to enroll a dependent. The buy-down plans actually have lower rates than the base plan, so enrolling a dependent might be more affordable on the buy-down plans. Those are going to be the Kaiser Gold plans, Kaiser Gold HMO-B, and Aetna Gold HMO-A. Then we have the buy-up PPO plans, meaning if the PPO plan is $500 a month and the HMO plan is $400 a month, you would pay the difference of the $100 between $400 and $500, which would be a buy-up. The Anthem Gold PPO-C and the Anthem Gold PPO-D. Other plan providers include Humana, who offers dental and vision coverage, and these are 100% employee paid. Okay, so what is changing? All medical plans are changing, but then also new this year is there will be no more paper application. The enrollment process will be done online through an online benefits administration system called Maxwell Health. Here are the easy-to-use steps for Maxwell Health. Okay, first, you're going to receive a welcome email from your employer prompting you to make a username and password. Okay. What you're going to do is you're going to review and confirm that your information is correct. The system has been preloaded with your information. Next, you're going to enter any dependent information that you want quoted on the plan. It's very important if you enter your dependent information and you see what the price is for them and you don't want to enroll them, you have the option of not enrolling them. So this is really just to see how much it would be to cover a dependent or a spouse. Then you're going to go ahead and shop for your benefits. The layout is really made to look like an Amazon or eBay shopping experience, so you're going to get to pick and choose plans and compare coverages as well as pricing. Then you would select the level of coverage for you, your spouse, and dependent. Then you have the opportunity to review your benefit summary. And right here, you're going to have a checkout where you're going to see exactly how much will be coming out of your check. After your checkout, you can review the summary of benefits in Maxwell Health at any time. You can log in at any time. Maxwell Health does have a support center as well as Arroyo. So we are going to be on site helping you navigate through this system. But if you would like to reach out to Maxwell Health directly, you also can. Okay, now we're going to get into the summary of benefits. As you can see, you have group medical, dental, and vision insurance. So the HMO base plans are here. These are the Kaiser Platinum HMO and Aetna Platinum HMO plans. In the small group medical marketplace, there are metal tier plans, and they go bronze, silver, gold, and platinum. So these are platinum plans, which signify that they are the best plans in the marketplace. As you can see, you do not have any individual or family deductibles for each plan. The individual out-of-pocket maximum is $4,000 for each plan, and for families, it is $8,000 for each plan. This number represents the most that you would spend in a plan year, okay, in a calendar year. It goes January 1st through December 31st, okay? Primary care physician office visits on the HMO plan, it is a $10 copay per visit. On the Aetna Platinum HMO plan, it is a $20 copay per visit. For a specialist office visit, it's $10 on Kaiser, $40 on Aetna. For preventative care visits, there is no charge on either plan. Okay, so that means a physical once a year and a well woman exam once a year. If you are enrolling dependents, both of these plans have pediatric dental and vision included. Okay, lab and x-ray procedures are $20 copays for lab and $40 copays for x-ray on the Kaiser plan. $20 copay for lab on the Aetna plan as well, and $40 copay for x-ray on the Aetna plan. For MRI and high-tech services, you do have a $150 copay per procedure on each plan. Now, if you're to be hospitalized on the Kaiser plan, you have a $300 copay per day up to a 5-day max. What that means is if you stay a week, you would only pay the first 5 days at $300 copay per day, and the rest would be covered at 100% by the insurance company. Doesn't matter if you stay a week or a month. On the Aetna plan, you have a $250 copay per day up to a 5-day max. Again, if you stayed a month, you would only pay the first 5 days at $250 copay per day. If you have an outpatient surgery in a hospital, you would pay $300 copay per procedure on the Kaiser plan and $250 copay per procedure on the Aetna plan. For emergency room visits, you have a $200 copay on the Kaiser plan and a $150 copay on the Aetna plan. For urgent care visits, you have a $10 copay on the Kaiser plan and a $40 copay on the Aetna plan. For ambulance transport, you have a $200 copay per transport on the Kaiser plan and a $150 copay per transport on the Aetna plan. Okay? So there are no annual prescription drug deductibles on either plan. For Tier 1 generic 30-day supplies, you have a $5 copay on each plan. For Tier 2 brand name 30-day supply, you have a $15 copay on each plan. For Tier 3 non-formulary and newly patented medication, you have a $15 copay. Prior authorization would be required on each plan. For the Aetna plan, you would have a $25 copay. For Tier 4 specialty drugs, you will have a 10% coinsurance up to a $250 max on the Kaiser plan and a 10% coinsurance up to a $250 max on the Aetna plan. For the mail order 90-day supply, if you're taking something for a chronic condition, you can pay for 2 months of the medication and get 3 months delivered to your home at no delivery charge on each plan. Okay, so these are the HMO base plans. Now let's review the buy-down HMO plan options. So the buy-down HMO plan options are going to be the Kaiser Gold HMO-B and the Aetna Gold HMO-B. They are the gold metal versions of the base plans, which are the platinum metal versions. Okay? So you don't have individual or family deductible on either plan, but your individual out-of-pocket maximums are $6,000 and $12,000 for family. Again, these numbers represent the most that you would spend in one plan year. After that, the insurance company would cover everything at 100%. For primary care office visits on the Kaiser plan, you have a $30 copay per visit. On the Aetna plan, you would have a $20 copay per visit. For specialist office visits, you have a $30 copay per visit on the Kaiser plan, and on the Aetna plan, you would have a $60 copay per visit. Preventative care visits are absolutely no charge. This includes a physical and a well woman exam each year. Pediatric dental and vision are included if you enroll your dependent under 18. For lab and x-ray procedures, on the Kaiser plan, you have a $40 copay for lab and a $50 copay for x-rays. On the Aetna plan, you have a $20 copay for lab and $60 copay for x-rays. For MRI and high-tech services, you have a $250 copay on each plan. Now, if you're hospitalized on the Kaiser Gold plan, you would have a $600 copay per day up to a 5-day max, and a $750 copay per admission on the Aetna plan. So what that means is that with that $750 copay per admission, it doesn't matter if you stay 1 night or 30 nights. You would still only pay that $750 copay per admission. Outpatient surgery in a hospital would be $600 copay per procedure on each plan. Emergency room visits would be $250 copay per visit on each plan. For urgent care visits on the Kaiser plan, you would have a $30 copay, and on the Aetna plan, you would have a $50 copay. Ambulance rides are $250 on the Kaiser plan and $150 copay on the Aetna plan. Now we're getting down to the annual prescription drug deductible, and I do want you to notice that on the Aetna plan, you have a $250 deductible that applies to brand, non-formulary, and specialty drugs. There is a mandatory generic substitution, which means that if there is a generic substitution, you can only pay the generic substitution price, which would be $20. But if you get brand name medication, then you would have to pay the $250 out of pocket once a year before you get the Tier 2 brand name medication, Tier 3 non-formulary, and Tier 4 specialty drugs. On the Kaiser plan, you don't have to worry about that. There is no deductible. So Tier 1, $15 on the Kaiser plan, $20 on the Aetna plan. Tier 2, brand name medication, $50 on the Kaiser plan, and then $250 deductible on the Aetna plan, plus the $50 copay. Once you pay the $250 deductible, that's once a year. For Tier 3, non-formulary, you have a $50 copay on the Kaiser plan and a $100 copay on the Aetna plan. For Tier 4 specialty drugs, you have a 20% coinsurance up to a $250 max and a 30% coinsurance up to a $500 max on the Aetna plan. The 90-day mail order supply is available on both plans. Are there any questions so far on either HMO plan options? Okay, so I'm going to go ahead and continue with the PPO plan options. Now the PPO plan options available are through Anthem Gold PPOC and Anthem Gold PPOD. The major difference here is that the Anthem Gold PPOC has a $500 individual deductible and a $1,200 individual deductible for the Gold PPOD. The family deductible on the PPOC is a $1,500 deductible, whereas the PPOD has a $2,400 deductible. Individual out-of-pocket maximum is $4,000 on the PPOC and $3,500 on the PPOD. Family out-of-pocket maximum is $8,000 on the PPOC and $7,000 on the PPOD. Now for primary care and specialist office visits on the PPOC, you have a $25 copay for the first 3 visits and then 20% coinsurance after deductible for any visits after that 3rd visit. For the PPOD, you have a $20 copay with the deductible being waived for primary care office visits, and for specialist visits, you have a $40 copay, which the deductible is waived on that as well. For preventative care visits, again, no charge. We really encourage everybody to get a physical woman exam every year. It's absolutely no charge to you. If you are enrolling dependents on these plans, pediatric, dental, and vision is included. Now, when you get to lab and x-ray procedures, you're going to have a 20% coinsurance after the deductible on each plan. For MRI and high-tech services, you're going to have a 20% coinsurance after the deductible on each plan. If you are hospitalized on the PPOC, you would pay a $500 copay per admission after the deductible. On the PPOD, it would be a 20% coinsurance after the deductible. For outpatient surgeries in the hospital, you have a $250 copay after deductible on the PPOC and a 20% coinsurance after deductible on PPO-D. For emergency room visits, you have a $250 copay per visit after deductible on PPOC and a $200 copay plus 20% coinsurance after deductible on PPO-D. For an urgent care visit on PPOC, it would be a 20% coinsurance after deductible, and on PPO-D, it would be a $100 copay with a deductible being waived. For ambulance trips on the PPOC, it would be a 20% coinsurance after deductible, as well as on the PPO-D, a 20% coinsurance after deductible. Now, when we get down to prescription drugs, there are no prescription drug deductibles on the PPOC, but the PPO-D does have a $250 brand name drug deductible. So for Tier 1, generic 30-day supply, $15 copay on each plan. For Tier 2, brand name 30-day supply, on PPOC you have a $40 copay, whereas on PPO-D you would have to pay out of pocket the $250 deductible one time a year, and then you would access that $40 copay. Same applies to Tier 3 and Tier 4 medication for the PPO-D. So for Tier 3, non-formulary 30-day supply, on the PPOC it is $80 copay, and on the PPO-D it is an $80 copay after the $250 deductible. For specialty drugs, on the PPOC, you have a 25% coinsurance up to a $250 max. On the PPO-D, you have a 30% coinsurance up to the $500 max. For mail order, 90-day supply, you purchase 2 months of medication and you get 3 months sent to your home address at no delivery charge. These are the PPO buy-up plan options available for you. Now we get to dental. So the major difference between the two dental insurance plans is that one is an HMO plan. Okay, it's the DHMO plan option, where, as you can see on the column that it represents, you see a lot of C fee schedule. And what that means is that on the fee schedule that you're going to receive after this webinar, every copay that you would have for any type of dental utilization is listed on this fee schedule. So you know exactly what you would pay for a filling. You know exactly what you would pay for a crown and a root canal. On the PPO, you pay percentages of the contracted price, and those are the ones that I'm going to review right now. On the Humana PPO, you have an individual deductible of $50. That's one time a year you pay $50. A family deductible of $150. That's one time a year. You have an annual benefit minimum of $1,500 per insured person per year, whereas on the DHMO option, you have unlimited, so you can have unlimited work done on the DHMO. There are no coverage waiting periods on each plan. Out-of-network reimbursement, very important. On the DHMO, you have none because it works as an HMO. You have to stay within network or else you don't have an out-of-network reimbursement. On the PPO, you have maximum allowable charge, which means that you would get the contracted price of dentists in the area. So what that means is on the PPO, if you go to a dentist that doesn't take insurance, you still have an out-of-network reimbursement. If you went to that same dentist on the DHMO, you wouldn't have any kind of reimbursement. So for preventative and diagnostic care benefits, on each plan, it's 100% no copay. This is one cleaning every 6 months, twice a year. Okay, so include exams, x-rays, cleanings, fluoride treatments, and sealants. 100% no copay. For a basic care benefit on the DHMO, you would look at the fee schedule. On the PPO, you would have it 80% after deductible. Okay, co-insurance. What that means is you pay 20% of the price, the contracted price, and the insurance company pays 80% of the contracted price. Okay? This includes space maintainers, oral surgery, fillings, stainless steel crowns, periodontics, and endodontics, which means root canals. For major care benefits, you have a 50% coinsurance after deductible. Okay, what that means is that you pay half of the contracted price, the insurance company pays half of the contracted price. This includes crowns, inlays, onlays, bridge work, dentures, and denture realigns and rebases. Okay, very important that on the PPO option, there is no orthodontia benefit. There are no braces that you can get on the PPO option. If your kids need braces, you would need to put them on the DHMO option. Okay? So those are the dental plans that are available for you this year. Now we get down to our vision insurance. Vision insurance is through Humana as well. And the frequency of service that you can get is you can get an exam every year, you can get lenses every year, and you can get frames every year. The copay for an eye exam is $10. If you get single, bifocal, or trifocal lenses, that is each a $15 copay. For frames, you have $130 to $150 retail allowance and 20% off the remaining cost of the frames. You can get contact lenses instead of frames and lenses, and you do have a $150 allowance for those contact lenses as well. LASIK surgery discounts are available, but you would need to contact a LASIK surgery center within Humana's network. Okay? So this is your vision plan. And that is the end of our presentation. Are there any questions that we can address right now? Okay, with that being said, what we're going to do now is send you materials so that you can see all of the summary and benefits and coverages for the plans that we've offered. You're also going to receive the Maxwell Health flyer and detailed instructions on how to enroll. And if you have any questions, please feel free to sign up for one of the enrollment workshops that we're going to be hosting in the next coming weeks. Thank you for your time. I appreciate your participation, and I look forward to seeing you at the enrollment workshops. Thanks so much.